Part A. Extract 1. Questions 1 to 12. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes. Good morning, Mihiraa. I understand you're here today to discuss some ongoing concerns about your health. Could you please explain to me in a bit more detail what's been troubling you?
Yes, it's been a bit worrying, really. For the last 6 months, I've been feeling constantly tired, weak, and dizzy, almost all the time. I've also had these awful headaches, especially when I try to concentrate. Recently, I've started having problems with my stomach as well, bloating, nausea, and sometimes even feeling full after eating just a little. My periods have also stopped completely for the past 3 months, which is strange for me. I've tried to brush it off, thinking it would get better, but it's only getting worse. Well, I've been taking some over-the-counter iron supplements because I thought maybe the tiredness was due to anemia. I also started on a multivitamin, but neither seems to help. For my headaches, I've been taking paracetamol or ibuprofen, but they only give temporary relief. I've even tried drinking herbal teas for nausea and bloating, like ginger tea, but that hasn't helped much either. I've always been quite healthy until recently. I did have a brief period of anxiety last year, but it wasn't too bad. My GP prescribed some medication for that, sertraline, I think it was, but I only took it for about 2 months because I started feeling better. Other than that, I haven't really been on any medications.
Alright, and is there any family history of medical conditions that you know of? Things like diabetes, thyroid problems, or eating disorders, for instance.
Not that I can think of, no. My parents are generally healthy, though my mother struggled with her weight for a while, and she tried dieting a lot. But nothing serious, at least not that she mentioned. I don't think there's anything related to my current symptoms.
Thanks for that information. I understand this might be a sensitive topic, but based on what you've described, I do have some concerns. We've run several tests, and the results indicate significant weight loss, low blood pressure, and a noticeable drop in your body mass index. Additionally, your blood tests showed low levels of essential nutrients, including iron and electrolytes. Given all of this, I'm concerned that we might be looking at a condition called anorexia nervosa. It can often present with symptoms like fatigue, amenorrhea, and digestive problems. I understand that it can be difficult to hear, and many patients feel the same way initially. The condition doesn't always mean not eating at all. Sometimes, it involves a reduced intake or feeling full after small amounts of food, like what you've been describing. It's also common to experience a lack of appetite and discomfort after eating. The symptoms you've been reporting align closely with this condition, and the test results suggest your body isn't getting the nutrients it needs.
But I've never thought about restricting my food or anything like that. I just thought my body was reacting to something else, maybe stress or... I don't know. It doesn't feel like I have an eating disorder.
I hear you, Mihiraa. This is complex, and many factors can contribute to it, including stress or changes in life circumstances. I believe the next step is to focus on a treatment plan that includes nutritional support, therapy to explore any underlying emotional factors, and possibly medication to help with the symptoms you're experiencing. We might consider prescribing cyproheptadine to help restore your appetite and improve nutrient absorption. Along with that, psychological therapy will be important. Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. What brings you in today?
Good morning, doctor. I've been feeling unwell for the past few days. It started with a sore throat and fever, but now I've also developed a rash on chest. It's spreading, and I'm really worried.
I see. Have you noticed any other symptoms, like headaches, chills, or swollen glands?
Yes, actually, all of that. My throat feels extremely raw, and my skin feels itchy around the rash. The fever comes and goes, but when it's there, it's really intense. I'm also feeling more tired than usual.
That sounds quite distressing. How are these symptoms affecting your daily life?
It's been awful. I'm struggling to sleep because of the itching and discomfort. I've been taking time off work because the fatigue is just overwhelming. My appetite is gone, and I feel like I can barely concentrate. It's really starting to get in the way of everything.
I can imagine. Having these symptoms persist over several days can really take a toll, both physically and emotionally. Let me explain what could be happening. From what you're describing, a sore throat, fever, rash, and fatigue, these are often associated with an infection. This illness typically starts with a streptococcal infection in the throat, causing the bacteria to release toxins that lead to the rash. The rash you mentioned, especially if it feels rough or sandpaper-like, could be linked to something called scarlet fever.
Isn't that a bit serious?
It can be if left untreated, but with proper care, it's very manageable. Before we proceed, could you tell me if anyone in your family has experienced similar symptoms recently or in the past?
Actually, my younger sister had a bad case of strep throat about 2 weeks ago. She was prescribed antibiotics, and she seems fine now. But I didn't think it could be related.
To confirm the diagnosis, I'll order a throat swab to test for the bacteria present. We'll also do a complete blood count, CBC, to see if there are any markers of infection. These tests should give us a clear answer.
How long will it take for the test results?
If the tests confirm the fever, the treatment will primarily focus on antibiotics, as this is a bacterial infection. I'll prescribe cephalosporins, which is typically the first line of defense against the bacteria.
How long will I need to take the medication?
You'll need to take the antibiotics for 10 days. Even if you start feeling better earlier, it's crucial to complete the full course to prevent complications. If left untreated, it can lead to more serious conditions like rheumatic fever or kidney damage. But don't worry, with prompt treatment, these risks are very low.
And what about the rash? How can I manage the itching?
For the rash, I recommend using a mild antihistamine to relieve itching. You can also try calamine lotion or cool baths to soothe the skin. The rash should start fading once the infection is under control.
That sounds manageable. Is there anything else I should be aware of?
Just be mindful of any worsening symptoms, especially if the fever persists or if you notice swelling in the joints or any difficulty breathing. These would be rare complications, but it's always good to keep an eye out. Otherwise, you should make a full recovery soon.
Thank you, doctor. I'll start the treatment as soon as possible.
That is the end of Part A. Now look at Part B.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen.
Now look at question 25. You hear a nurse called Mihiraa talking to a doctor. Now read the question.
Dr. Hilton, I'm concerned about Mr. Phillips' surgical wound. It appears to be infected.
Thank you for bringing this to my attention. Let's assess the wound and discuss treatment options.
The wound is showing signs of redness, swelling, and drainage. The patient is also complaining of pain and tenderness.
Those are classic signs of infection, Mihiraa. We'll need to culture the wound to identify the specific bacteria causing the infection.
I've already collected a wound swab and sent it to the lab.
Good. In the meantime, we can start treatment with antibiotics based on the most likely pathogens. We'll adjust the medication once we receive the culture results.
I'll also ensure that the wound is cleaned and dressed properly to promote healing.
That's important, Mihiraa. We'll need to monitor the wound closely for any signs of improvement or worsening.
Now look at question 26. You hear a nursing manager called Mihiraa conducting a morning meeting. Now read the question.
Good morning, team. I'm excited to announce that we'll be implementing a new policy requiring all staff to wear compression stockings during their shifts. This initiative aims to reduce the risk of deep vein thrombosis, DVT, and improve overall well-being.
That's a great idea, Mihiraa. I've heard compression stockings can help prevent blood clots.
Exactly. By applying pressure to the legs, compression stockings can help improve blood circulation and prevent blood from pooling, which can lead to DVT.
I'm concerned about the comfort of compression stockings. Won't they be uncomfortable to wear for long periods?
While they may take some getting used to, modern compression stockings are designed to be more comfortable and breathable. It's important to choose the right size and compression level for optimal comfort and effectiveness.
Mihiraa, will we be provided with compression stockings or should we purchase our own?
The hospital will provide compression stockings to all staff members. We'll ensure that everyone has access to the appropriate size and compression level.
Now look at question 27. You hear a doctor called Mihiraa talking to a nurse. Now read the question.
Nurse Hilton, I'm concerned about Mr. Phillips' long-term prognosis. His condition has deteriorated significantly.
Yes, I've noticed a decline in his overall health. He seems to be struggling more with daily activities, Dr. Mihiraa.
We'll need to discuss end-of-life care options with Mr. Phillip and his family. It's important to involve them in the decision-making process.
That's a difficult conversation to have. Should I initiate the discussion or would you like to speak with them directly?
I think it would be best for me to have a direct conversation with Mr. Phillip and his family. I can explain the current situation and discuss the available options.
That's right, Dr. Mihiraa. I'll schedule a meeting with Mr. Phillip and his family to address their questions and concerns.
Thank you. We'll need to provide them with information about palliative care, hospice services, and other end-of-life options. It's important to support them during this challenging time. Thank you. We'll need to provide them with information about palliative care, hospice services, and other end-of-life options. It's important to support them during this challenging time.
Now look at question 28. You hear a physiotherapist called Mihiraa talking to an occupational therapist. Now read the question.
Dr. Hilton, I'm concerned about Mr. Phillips' mobility limitations. He's struggling with activities of daily living, and I believe he could benefit from assistive devices.
That's a good point, Mihiraa. What specific devices do you think would be helpful for him?
Based on his current condition, a walker or a cane might be beneficial for ambulation. Additionally, a grab bar in the bathroom could help him with transfers and maintaining balance.
Those are excellent suggestions. We should also consider his home environment. Are there any modifications we can make to his home to improve his mobility and safety?
Perhaps installing ramps or widening doorways could be helpful. We can conduct a home assessment to identify any necessary modifications.
That's a great idea. We can also discuss the possibility of obtaining a wheelchair or other mobility aids if needed. Mihiraa.
It's important to select the right assistive devices to meet Mr. Phillips' specific needs and ensure his comfort and independence.
Now look at question 29. You hear a head nurse called Mihiraa conducting a meeting. Now read the question.
Team, I want to discuss our emergency evacuation plan. It's crucial that everyone is familiar with the procedures in case of a fire, natural disaster, or other emergency.
I remember going through the evacuation drills last year, Mihiraa.
That's great. It's important to review these procedures regularly to ensure everyone is prepared. In case of an emergency, we'll follow a designated evacuation route and assemble at the designated assembly point.
What should we do if we encounter someone who needs assistance during the evacuation?
If you encounter a patient or colleague who requires assistance, please inform the evacuation team leader immediately. They will coordinate the necessary support.
Are there any specific items we should grab before evacuating the department, Mihiraa?
It's important to prioritize patient safety and evacuate promptly. However, if time permits, you can grab essential items such as your personal belongings and any necessary medical equipment.
Now look at question 30. You hear a doctor called Mihiraa giving a handover to a colleague. Now read the question.
Dr. Hilton, I'm handing over Mr. Phillip to you. He was admitted earlier today with chest pain and shortness of breath. His vital signs are stable, but we're still monitoring his cardiac status.
Thank you, Dr. Mihiraa. I've reviewed Mr. Phillips' chart and am familiar with his history.
He has a history of hypertension and high cholesterol. We've administered pain medication and oxygen therapy. Please continue to monitor his vital signs and report any changes.
Will we need to conduct any further tests?
Yes, we'll need to order an electrocardiogram, ECG, and cardiac markers to assess his heart function. We're also considering a chest X-ray to rule out any underlying pulmonary conditions.
I'll coordinate the necessary tests and inform Mr. Phillip about the plan, Dr. Mihiraa.
Please ensure he's comfortable and has any necessary medications readily available. We'll continue to monitor his condition closely and adjust treatment as needed.
That is the end of Part B. Now look at Part C.
Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a nephrologist, Dr. Mihiraa, and an interviewer.
Dr. Mihiraa, thank you for joining us today. I understand your recent research focuses on the patterns of sensory processing disorders. Could you explain the main focus of your study?
Absolutely. Our study primarily focuses on understanding three distinct patterns of sensory processing disorders, SPDs. The aim is to identify the neurological and physiological underpinnings of these patterns and their impact on everyday functions. These patterns, sensory modulation disorder, sensory discrimination disorder, and sensory-based motor disorder, are of particular interest because they present unique challenges in diagnosing and managing patients. What differentiates this research is our attempt to explore the link between these sensory irregularities and kidney dysfunctions, an area rarely examined in SPD studies. We hypothesize that kidney-related metabolic imbalances may exacerbate certain neurological processes, thus affecting sensory regulation.
Fascinating. How did you initiate the study, and what were the first steps, Dr. Mihiraa?
We began by thoroughly reviewing existing literature on sensory processing disorders, but it became evident that most studies lacked a comprehensive analysis that integrated metabolic and nephrological aspects. To bridge this gap, we conducted a preliminary phase involving case studies of patients with co-occurring kidney dysfunctions and sensory irregularities. It was important to establish an interdisciplinary framework, bringing together nephrologists, neurologists, and occupational therapists. Initially, we encountered difficulties in creating a cohesive approach to analyze sensory data because kidney dysfunctions and sensory disorders typically fall under entirely different specialties. So, the first steps involved creating standardized protocols for evaluating sensory symptoms in patients undergoing treatment for kidney disorders.
That sounds like a complex study to set up, Dr. Mihiraa. What were the main challenges you faced during this research?
The most significant challenge was the multidisciplinary nature of the study. Nephrology and sensory processing disorders do not naturally intersect in clinical practice, so coordinating between specialists posed a challenge in itself. Additionally, obtaining funding for research that crosses traditional medical boundaries was tough. Sensory disorders tend to be viewed primarily through a psychological or developmental lens, while nephrology focuses on physiological aspects, so getting grants approved for a study involving both was an uphill task. Another major challenge came in the data collection phase. Patients with kidney dysfunctions often have varying degrees of sensory irregularities, making it difficult to define consistent patterns. We had to invest heavily in developing assessment tools sensitive enough to capture subtle differences in sensory processing among these patients.
That's incredibly detailed work. Could you share any recent developments or breakthroughs in your study, Dr. Mihiraa?
We've had some exciting developments recently. We discovered that certain metabolic markers typically associated with chronic kidney disease, CKD, such as elevated urea and creatinine levels, directly correlate with heightened sensory sensitivity in some patients. This was an unexpected discovery because we initially hypothesized that metabolic dysfunction would lead to a dampening of sensory perception due to neurological degradation. However, in some subtypes of sensory processing disorders, especially in sensory modulation disorder, the opposite effect was observed. Patients were more sensitive to external stimuli, particularly tactile and auditory cues. These findings could open a new avenue of treatment that targets metabolic regulation to alleviate sensory symptoms, something that has never been considered before.
That's intriguing, especially in light of the complexities surrounding SPD. Dr. Mihiraa, what are the expected outcomes of your study as it continues?
Based on the results we've seen so far, we expect to establish a clearer understanding of how kidney dysfunctions impact sensory processing in a broader medical context. Our ultimate goal is to develop tailored treatment protocols that address both kidney-related metabolic issues and sensory dysregulation simultaneously. For instance, by targeting specific metabolic markers, we may be able to alleviate sensory overload symptoms in patients suffering from SPD. Moreover, we hope to build a more robust diagnostic framework that allows healthcare providers to screen for sensory processing issues in patients with chronic kidney disease. This could result in earlier interventions and more personalized treatment strategies.
It sounds like the potential outcomes could have wide-reaching implications. Speaking of which, Dr. Mihiraa, how do you think this study will impact the medical field as a whole?
The impact could be substantial, particularly in two areas. First, it could revolutionize the way we approach comorbid conditions in patients with chronic illnesses like CKD. Traditionally, sensory disorders and kidney issues are treated as separate entities, but this research could pave the way for more holistic treatment approaches that take into account the intricate interplay between metabolic health and neurological functioning. Second, it could have broader implications for how we understand and treat sensory processing disorders in general. If metabolic markers can indeed influence sensory perception, this could lead to breakthroughs in how we manage SPD in populations beyond kidney patients, potentially transforming how pediatric and developmental SPD cases are treated as well.
Now look at Extract 2. Questions 37 to 42. You hear an oncologist, Dr. Hayden Joe, talking about the unforgettable journey in his career. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone. Today, I'm here to share a memorable and rather challenging case involving a patient named Mihiraa. Her story is not just one of medical complexity but also of human resilience, difficult decisions, and the power of teamwork. As an oncologist, there are patients whose journeys leave a deep imprint on your mind, and Mihiraa is undoubtedly one of them. Why do I remember Mihiraa so deeply? It's a question rooted in more than just clinical details. When she first came to me, she was in her late 30s, an age when many of us were focused on building our careers, families, and dreams for the future. Mihiraa, however, was living under a heavy cloud of uncertainty because of a rare type of tumor called a thymoma. What struck me about her wasn't simply her diagnosis, but her sheer determination to remain in control of her life. Mihiraa had a calmness that was paradoxical to the weight of the situation, yet I could sense the underlying fear she carried every time we spoke. It was this juxtaposition of strength and vulnerability that made her case unforgettable to me. I wasn't treating just a tumor, I was interacting with a person whose hope and willpower continually reminded me that my decisions, my actions, would ripple into her entire life, medically, emotionally, and socially. The challenging situation we encountered revolved around the decision regarding her treatment pathway. Thymomas are rare, and their behavior can be quite unpredictable. With Mihiraa, the tumor was encroaching upon critical structures in her chest, including major blood vessels, complicating the treatment options. Surgery seemed like the obvious choice initially, but the proximity of the tumor to these vital organs made the risks astronomical. Any slight miscalculation could lead to catastrophic complications like severe bleeding or even death. Moreover, Mihiraa had a history of autoimmune issues that further complicated the potential outcomes. We faced a dilemma: aggressive surgical resection with significant risks, or a more conservative approach using radiation and chemotherapy with uncertain efficacy. In the end, after much discussion with the patient, her family, and a multidisciplinary team, we opted for a pre-surgical chemotherapy approach to shrink the tumor. This would give us a better chance of performing a safer operation later on. The decision was tough, not just because of the clinical uncertainties but because it required a balance between Mihira's desire for swift action and our need for caution. Supporting Mihiraa wasn't just about choosing the right medical procedures. It was also about providing psychological and emotional support. Every visit involved more than updates on her tumor or test results. We needed to walk her through the possible outcomes, no matter how daunting, without diminishing her sense of agency or hope. Communication was key here. She needed to understand the gravity of her situation, but also feel reassured that she was not alone in this journey. I worked closely with the nursing team, a psychologist, and a nutritionist to ensure that her holistic well-being was being attended to. Additionally, we arranged for support groups where she could connect with others going through similar experiences. This multifaceted approach was critical in maintaining her mental strength, which is so often overlooked in cancer treatment. The multidisciplinary teamwork involved in Mihiraa's care was one of the most coordinated efforts I've been a part of. Oncology is never a solitary endeavor, and in this case, it was even more evident. I worked hand in hand with cardiothoracic surgeons, pulmonologists, radiologists, and anesthesiologists to formulate a comprehensive treatment plan. Every meeting felt like a chess game, where each specialist provided insight from their respective fields, offering various strategies and possible moves. Radiology helped us better understand the positioning of the tumor, while the surgeons provided their expertise on the feasibility and risks of surgery. Pulmonologists contributed valuable input on how her lung function might be affected during and after treatment. No single decision was made in isolation, it was always a team consensus, constantly adjusting based on Mihiraa's evolving condition. This collaborative spirit underscored the complexity of oncology. It's not just about the doctor and patient but about a network of experts converging to find the best path forward. The result of our combined efforts was nothing short of extraordinary. After completing her pre-surgical chemotherapy, the tumor had shrunk sufficiently, allowing the surgeons to perform a successful resection. It was a long and complex surgery, but Mihiraa pulled through without any significant complications. Post-operatively, she required intensive monitoring and rehabilitation, but within a few months, she was on the road to recovery. It wasn't just the physical removal of the tumor that marked this as a success, it was the fact that we had navigated such a high-stakes case with precision, thoughtfulness, and care. As I reflect on Mihiraa's case, I can say that it holds a special place in my career. Every oncologist faces difficult decisions, but few cases demand the level of cross-disciplinary cooperation, risk management, and patient-centered care that we experienced here. Mihiraa taught me the importance of patience and trust, not just in science but in the process, the people around you, and most importantly, the patients themselves. It's cases like these that shape your career and make you realize that medicine is as much about heart as it is about skill.
That is the end of your OET listening test. Now check the answers.